This is the ICD-10 PCS presentation coding. So let's go ahead and get started. Case 1, this patient presents today after a non-productive cough for the last 4 weeks. Last week he had a chest x-ray that felt that further diagnostic testing was necessary. Today he underwent a fiber optic bronchoscopy of the tracheobronchial tree. The images were sent to radiology for interpretation. A plan of care will be determined after the radiology report is read. So the main term here, or root operation, is bronchoscopy, which gives us this big long code. Move over here, we can see that the section is 0, medical and surgical. The body system is B, respiratory system. The operation is J, inspection. So that is our root operation. Body part is the tracheobronchial tree, making it 0. The approach is via natural, artificial, or opening endoscopic. The device is no device and no qualifier, making us the code of 0BJ08ZZ. Moving on to case 2. This 29-week pregnant patient was experiencing clamplasia. She was being admitted today so the fetus can be monitored closely. This is a product of conception because we are monitoring a fetus. Moving on down to the plan, we have a patient placed on low salt diet. Vaginally inserted fetal monitoring electrodes were placed. This is an insertion since it is saying it is inserted these fetal monitoring electrodes. So if we go up here, put in insertion, and then we type in product of conception, it will give us these 4 characters. Moving over here, the section showing 1 of obstetrics. Its body system is 0, pregnancy operation is H, or the root operation or main term is insertion, making it H. Its body part is the products of conception. Its approach is, if I remember, 7. Yes, 7 via natural artificial opening. The monitoring electrode is 3 for its device, and there is no qualifier. That gives us the code of 10H073Z. Case number 3. The patient is a 9-year-old male who presents today with pain in his right arm after falling off his bike. He was not unconscious at any time. His right arm is swollen and the pain is increased when the arm is moved. An x-ray of the right arm showed the fracture in the upper extremity. This fracture is well aligned and no alignment is necessary. A cast was placed on the right upper extremity. This casting is immobilization, but we're going to start with this x-ray, because that is also a procedure that was done. So we type in X, it shows us x-ray, which brings us to plain radiography. We go into plain radiography, it puts it in the index for us, so we can just put arm and then right. It gives us the full x-ray code. So its section would be B for imaging, its body system would be P for the non-axial upper bones. The type of it would be 0, which is the plain radiography that it put in for us. The body part being the upper right arm. No contrast, no qualifier again. That means the first code would be BP0EZZZ. So for the next one, the cast was placed on the right upper extremity. So we can type in the word cast into our index here, and it'll bring us to immobilization, which is the thing that we have in parentheses there. And then we could put in extremity. Cannot spell. Extremity. And it is the upper extremity, upper right in this case. That will give us these characters here. Whatever. Section is number 2 for placement. The body system is the amatogal regions, which gives us W. The root operation is immobilization, being 3. The body region is 8 for upper right extremity. The approach is external, making it X, and this is a cast, which makes it number 2. That gives us the code of 2W38X3Z. Case number 4. This 20-year-old patient is competitive college gymnast who has ongoing pain in her lower back due to inflammation. She presents today for an epidural injection of the anti-inflammatory in the sacral area. So injection means we're introducing a substance inside or on top of something. So we put in introduction. That'll bring us to it in our index. And then we could put epidural space and downwards from there, and the index is anti-inflammatory. Gives us this big long code. Go into here, we can see that the section is 3 for administration, body systems E for psychological systems and anatomical regions. Operation is, or root operation, or our main term is 0, being the introduction, which is where you are putting in something. Its body system / region is the epidural space. It's an epidural injection. Its approach is precutaneous. The substance is anti-inflammatory, and there is no qualifier. This makes it so the code is 3E0S3ZZ. Case number 5. This 23-week pregnant female is brought to the unit to monitor cardiac sounds of her child. The sounds are monitored using the endoscopic vaginal monitor, which is also a product of conception. So the main term here would be monitoring, which I'm pretty sure I did this very wrong, actually. I believe I did it in this area. So we are measuring and monitoring the psychological systems. We are monitoring. It would be in, excuse me, products of conception in the cardiac. So, and it is, we are looking, we're not doing anything, so it'd be via artificial opening endoscopic. We are listening to the sound, and there is no qualifier. So starting off the section, we have 4 for measurement and monitoring. The body system A, psychological systems, operation is, or our root operation is 1, monitoring, giving us the entire code. Of 4A1H8HZ. Check on time here. Yeah, we're doing okay. Case number 6. This 78-year-old male presents with a nosebleed that lasted 4 hours. The bleeding has increased over the last hour. He has a palate disorder, which is treated by Dr. Young. I packed the nasal area to stop the bleeding. I instructed him to follow up with Dr. Young in 1 day. The main term, or root operation. And here would be packing of the nasal area. So we type in our index, packing. And then we can put in nasal after that, which brings us to this big long code. Oops, that's the neck. So for our section, we have a 2 for placement. Body system is Y for anatomical orifices, representing the nose. The root operation or main term would be packing in this case, which makes it a 4. The body region, of course, is nasal for the nose. We have an external approach, the device being the packing material itself, and there is no qualifier. This gives us the code of 2Y41X5Z. Case number 7. This patient is a 20-year-old female, persists today, dilated 7 centimeters with contractions occurring every 3 to 4 minutes, lasting 30 to 40 seconds. This mother is also admitted a cocaine addict and is worried about how her baby will be born. At this time, we are trying to obtain a blood sample of the fetus to determine whether or not special services on standby in the ICU. The fetal monitor is showing a stable heart rate at this time. The amniosac is broken. The amnioscope is inserted through the vagina. A 0.05 incision is made in the scalp, and blood sample is aspirated into the tube for an STAT to the lab. Contractions have stopped, and the baby was not born at this time. The procedure that was completed was an endoscopic drainage via the vagina for fetal blood sample. So we can go drainage for our main term / root operation, and then we could put in vagina, which is where it was happening. Gives us these characters here. Move over. We have the section being 0, medical and surgical, the body system being U, female and reproductive systems, the root operation or main term being drainage, which is a 9. The body part in this case being the vagina gives us a G. The approach was, I believe, yes, via natural or artificial opening, not endoscopic since we are doing something. We are not just looking. The device in this case would be the drainage device itself, giving us a 0, and there is no qualifier. That means the code is 0U9G70Z. Case number 8. This 30-year-old patient with complaint of ear pain was placed in sublime position, and the left ear was examined using an operating microscope. The tympanic membrane was assessed for all debris was removed from the area. There was also note to be small, dark, foreign-colored object in the ear canal. The patient was awoke and transferred to recovery room in excellent condition. This is an exacerbation, I think it's pronounced, of the ear. So in the index we can type in exacerbation of the ear, and it is inside of the ear, and then it'll be the left ear. Gives us these characters here. Moving over, the section being 0, medical and surgical, the body system, in this case being the ear, which shows us 9, ear, nose, and sinus. Operation or root operation / main term is exacerbation. Its body part being the inner ear left gives us E. The approach in this case would be 8. And there is no device and no qualifier. That would give us the code of 09CE8ZZ. Let me just check on time here. We could probably make it. So let's go. Mrs. Smith was admitted to the nursing home on Thursday, and the nursing staff noted that she has a 2 by 3 centimeter wound on her back and left side. Today, I applied a sterile dressing to the area to protect it from infection. The main term here is the dressing of the wound. So if we go to our index here, we can type in dressing, and we can put in back after that. That gives us the big long code. Move over here, we have section being 2 for placement, the body system being W, which is the anatomical regions. The root operation or main term in this case is dressing, which gives us the number 2. The body region, of course, being the back of number 5. The approach was external, the device itself was the bandage, and there is no qualifier. That would give us the code 2W25X4Z. Case number 10. This 16-year-old female presents today following a soccer game in which she injured her right index finger. The finger is not broken but is swollen. I placed a splint on the right index finger and instructed the patient to wear a splint for the next 5 days and return to my office. This is stating an immobilization, but you can put in the word splint, which will send you to immobilization anatomical regions, giving you 2W3. So that would be meaning the section being 2 for placement, the body system being W for anatomical regions, the root operation or main term being the immobilization using of the splint, making it 3. The body region being number 5 for back is as an external approach. It is a splint, which gives us the number 1, and there is no qualifier. That would give us our final code of 2W3JX1Z. Thank you.